Welcome to the Health and Wellness Marketplace. Here's your host, Laura Lewis.
Hello and welcome to the Health and Wellness Marketplace. I'm your host, Laura Lewis. What is the Marketplace? Well, the Marketplace is your one-stop shop for the best vitamins and supplements on the planet. And best of all, you don't even have to leave your home to get them. Throughout the course of the show, we'll provide you, the viewer, information on how to obtain the items featured in the Marketplace. Of course, you can also go to our website at www.thehealthandwellnessmarketplace.com to learn more about the show and our guests. Do any of you suffer from arthritis? Are you tired of it? I know it can be frustrating dealing with the pain day in and day out. And to top it off, the prescription medications that you have come to rely upon have now been taken off the market due to severe side effects or like heart attacks or strokes. Have any of you taken Vioxx or Celebrex? That's what we're talking about today. Joining me today is Richard Lentz of the Seagate Company. Richard, thank you for being here.
Thank you for having me.
I mentioned Vioxx and Celebrex, Richard, and tell me a little bit about these drugs and what exactly happened when they were pulled off the market by the FDA.
Okay, well, the purpose of this, and I helped to organize the show, was to talk about what are prescription painkillers and what are the alternatives, and that the alternatives might be a lot safer and maybe even more effective than the Vioxx and the Celebrex. Mm-hmm. What happened with Vioxx was, I don't remember the pharmaceutical company then came up with Vioxx, but going back before Vioxx, people that had arthritis were taking aspirin or ibuprofen for pain. And everybody, as you get older, I think 65% of the women that are over 60 years old are going to have arthritis, and men catch up very quickly afterwards. And generally, we don't go for painkillers if we can avoid them unless it's getting very difficult for us. But the side effect of aspirin and ibuprofen was that they went after the COX-1 enzyme in addition to the pain. The COX-1 enzyme provided the mucus lining on our stomachs. So we ended up, as a side effect, was bleeding and ulcers. So the pharmaceutical companies came up with a COX-2 inhibitor that did nothing to COX-1, these enzymes that produce, there's a prostaglandin, which is the inflammatory response by the body.
Okay.
And so what they were looking for was something that wouldn't affect the stomach lining, that would affect the inflammation. Inflammation is usually what leads to pain.
Now, I believe we might have a graphic that's related to that right now. Let me go ahead and see. Oh, yes, it says here we've got Vioxx. This is where we are. Is that correct? Vioxx inhibits. Now, you're talking about COX-2 enzymes. That sounds so complicated. So in regulating prostaglandin production and inflammatory response of the body that is vital to healing and repairing, disclosed side effects such as diarrhea, nausea, headache, not disclosed 2 times the rate of strokes, or heart attacks, and blood clots. That's what you're referring to. That's really, to me, I don't really understand that very well. So can you kind of bring that down to earth a little bit? I know you're the scientist, and I'm just like, oh my gosh, I have some of that background, but I don't quite understand what was going on with that.
Well, yeah, what they were doing, it's a $1 billion industry. They had an average of $3 billion a year in sales selling Vioxx.
Okay.
The theory was great. We don't have anything to do with the stomach's production of mucus that lines and protects the stomach. So there was no side effect that aspirin and ibuprofen were having. They did have, the occasional diarrhea or the headaches or something. That's an acceptable side effect. But what they weren't telling people, and what they apparently were aware of, and why they were being sued as of 2 years ago, and why the FDA finally took it off the market, was that there were more serious side effects such as stroke, heart attack, and death.
Wow.
And, when you get into a small percentage of people having that, and they were in complete denial because, if you were making $3 billion a year selling a drug, you're going to want to be able to stretch that out as long as possible. Or I guess you look at the cost and benefits of selling a drug. Once the costs in lawsuits get closer to the benefits of sales, then it's time to pull the thing off the market.
I hate that. What about Celebrex?
Well, that was a similar case where I think it was only recently that they pulled that one off the market, and I think there's a slide on that one.
There we go. We've got it right there.
That one, the company had, there were side effects, same death, cardiovascular problems, kidney and liver damage, and ulcers. But this was a case where the company knew of hemorrhages and other side effects, but were able to push the FDA to allow them not to have to put that on the label very early on.
Well, it says there Celebrex is $3 billion annual sales, and that's another COX-2 inhibitor. In 1999, shortly after release, despite 10 deaths and 11 stomach hemorrhages, Pfizer pushed for removal of certain side effects from warning labels in order to gain marketing advantages. Actual side effects, as you said, is death, cardiovascular problems, kidney and liver damage, ulcers, and what is that at the very bottom? Acting FDA Commissioner Crawford called for continued evaluation. So that's what you're talking about. It's like they weigh it monetarily. Is that correct? I mean,
well, they weigh it, and also the FDA. There's different levels of drugs. You have over-the-counter, prescription, and they're looking at what are the relative benefits to the total population versus the relative risks.
Okay.
If you have 100 people being helped and maybe 1 out of 1,000 that has a side effect, well, that's going to be a good drug. If the side effect starts becoming more serious, other than an ulcer or a headache or whatever, now it's the danger of some disease or heart attack, then you better have a much higher level of benefits to the entire population in order to outweigh that 1 in maybe, I don't know what the acceptable level, 1 in a million dies, but you have 20 million people using it and it's working, then is that an acceptable level of bad side effects?
Yeah, I hate hearing the word acceptable and death used together. It's kind of a, but I understand exactly what you're talking about and where their rationale is. We've got to take a break real quickly, Richard, but when we come back, I'm hoping that you'll be able to talk about some of the great things that you have to offer that are natural alternatives to some of these very dangerous drugs that are on the market. We'll be right back after this. Welcome back to the Health and Wellness Marketplace. I'm speaking with Richard Lentz of Seagate. And Richard, we were talking about the dangerous side effects that were related to drugs for arthritis in the past, and then they had to pull them because of the risk and that type of thing, weighing the monetary benefits versus the acceptable death and that type of thing. I don't like that language very much at all. Now, but also if someone has a condition such as arthritis, but you can't get the medications that might help relieve the pain, are there some natural alternatives for that?
Well, exactly, and that's what the purpose of being in the natural foods industry is, that there are a lot of ways to skin that same cat of going after pain. And we have a slide. This is going to give you an example.
Okay, all right here.
And I'm not trying to be self-serving, because most of these are things that we don't necessarily produce ourselves. Curcumin, which comes from turmeric.
So that's pronounced curcumin, okay, from turmeric, which is a little...
curry.
Okay, it's curry,
Yeah,
all
just
right.
go and eat in an Indian restaurant.
Okay.
You get that one.
Curcumin, all righty.
There's one from China, Thunder God Vine.
I love that name, Thunder God Vine. But of course I can't say. I bet you can say that next word. Can you say that?
Well, only if it's the omega-3 fatty acids.
Okay. Chinese medicine. All right. The next one is omega-3 fatty acids.
There's resveratrol, which comes from grape skin.
Resveratrol. All righty.
Flavonoids, phenolics. These are available in most plants.
Okay.
And then the final one is shark cartilage. The first several we'll talk about in a minute have those also are COX-2 enzyme inhibitors.
Okay.
Prostaglandin is the chemical the body produces to control inflammation.
Okay.
And inflammation is what's associated with pain. But let me just speak on that one for a second. Inflammation is your body's natural mechanism for protecting itself after an accident or an injury.
Okay.
If you fall and your joint, if you fall on your elbow and your joint swells up, it's because your body's trying to protect that joint from A, further movement, and B, something else hitting it and causing more pain and more damage. And what happens when your body's releasing, the COX-2 enzymes release this prostaglandin, which causes the tissues surrounding that area where the joint or wherever you're swelling and the accident occurred to swell up, makes the blood vessels more porous so that the white blood cells can go to the site where the injury is, and the white blood cells get to those porous blood vessels, and they are able to get out into the tissue.
Start to help heal the tissue.
Heal, and they'll break down the tissue so that the new tissue can replace it. It's kind of like a control. I read about this in a magazine on the way over here. They called it a controlled burn, as if you were trying to prevent a large forest fire, you
Okay.
might have a small burn so that the body's actually getting rid of that tissue before it spreads and becomes a major problem.
So the function of the white blood cells is to burn away that damaged tissue, bring in the new guys.
Exactly.
Okay.
Now, where it gets out of control, where you become, like in California, that little controlled burn becomes 1,000 acres, is
Sure.
where that inflammation develops and spreads to other parts of your body. So what they were trying to do was control this prostaglandin production in your body and stop the spread of the inflammation, because inflammation becomes bad when it's not helping to protect a part of your body that doesn't need the protection. So we've got other products that can do this for you. But first, what I want to do before we do that is I want to give you an example of, we had this opportunity a couple of years ago to go prescription with one of our homeopathic medicines, and I just want to show you why the incentive is there for these drug companies.
Okay, alrighty.
This was a proposal for a Seagate's olive leaf extract nasal spray, which, by the way, we sell for $9.95 at home at health food stores.
Okay.
Now, if we had put this, and this was the offer of a friend that was in a pharmaceutical company, if we would sell it as a prescription drug, it would be in the $60 to $80 range total price. We would kick back $20 to $30 to the insurance company, because the insurance companies just don't insure that drug without getting money back from you. You know, they don't necessarily, you know, there's covered drugs and there's non-covered drugs.
Okay.
Well, what I understood was the covered drugs were covered because there was money being returned to help support the cost of that medicine.
Alrighty. Next one is optional pharmacist incentive.
$5.
What is, okay.
To the, you know, at your local pharmacy for the druggist to recommend that drug.
To recommend it, okay.
And then you have the wholesale and distributor cost, $10. So the net after all that to Seagate's $25 before the cost of production for a bottle that would cost us maybe $3 or $4 to produce in the first place. So the profit per bottle would have been $21 for something that we sell in stores and health food stores for $9.95, where our profit normally is about $1.50 per bottle.
Okay.
So that's the incentive.
I see.
And most people say, oh, well, my insurance benefits, they cover everything except my $10 copay. Well, they're paying for it out of pocket because their company, if you were making $40,000, probably you would have been making $44,000 because you wouldn't have been paying so much, or your company wouldn't have been paying so much for insurance. Somebody's paying for that insurance. So anyway, that's the incentive for it, and that's why companies like to go prescription when they can. We just are not that sophisticated, and besides, these are all natural ingredients, and there's no need to be selling something as a prescription.
Right,
Okay.
right.
That said, there are natural remedies that we can use for these kind of control of COX-2 enzymes that produce prostaglandin.
And on that note, guess what? I'm going to take a break. You got to hang in there.
Okay.
We'll be right back to talk about those right after this.
For antifungal and antibacterial support, try Seagate olive leaf extract. For those achy joints, use Seagate shark cartilage. Grapeseed extract, a powerful bloodstream antioxidant. Smooth skin softens and moisturizes with omega-3 fatty acids. Olive leaf nasal spray, all natural, completely safe for sinus irritations. Ask for Seagate in your local health food store or call us toll-free 1-888-505-4283.
Welcome back. We're talking about natural alternatives for arthritis and pain relief with Richard Lentz of Seagate. Richard, okay, just got to stop you right at the break there. Talking about natural pain relievers such as you had mentioned curcumin, for example.
Yeah, as you know, I'm passionate about this, that there's alternatives. It's not necessarily Seagate alternatives, but there are things out there, and people say which works better, and I'm just happy that there are some of these things that work. And I brought us a couple more slides just so that we can let the scientists that have tested it tell you exactly how it works.
Okay, alrighty.
Okay, you like that word. You can pronounce it.
I do. Okay, curcumin. Curcumin inhibited the cell growth of human colon cancer cells and also reduced the expression of COX-2 enzymes. Curcumin would appear to be a safe, natural COX-2 inhibitor in humans given its safety profiles and demonstrated anti-inflammatory activity. And that is from the proceedings of the American Association for Cancer Research annual meeting in 1999.
Yeah, known
Okay.
for a long time. I mean, this was before we had Vioxx and Celebrex going really strong, that these are not health food advocates. These are American cancer researchers that are finding that here's a natural substance. However, you can't take curcumin, make a patent out of it, and make a prescription medicine out of it unless you kind of added a couple of other little
Unless you
secret
altered
ingredients.
it. You can't do it because it's natural,
It's
correct?
natural,
Okay.
yeah. I mean, sure, you can make a prescription drug, but then 10 other people can do it because you aren't able to patent it.
Okay.
So there's
All
no
right.
incentive to do it because everybody else will get into the market. But it works, and they proved it, and it's not a product that we produce. And
Okay.
here's another alternative. We've got another slide.
Another
coming up.
slide? Okay, let's see the next slide. Do we have that available? Well, right here now.
Yeah.
Oh, I like this word right here. The term Thunder God Vine Extracts. I love that. Thunder God Vine Extracts. What a great name. Traditional Chinese herbal medicines have shown preliminary promise in treating rheumatoid arthritis patients. It reduced COX-2 protein expression, enzyme production without altering COX-1. What does that mean?
Same
First
as
of all?
when we started out before, we were talking about how these drug companies were trying to not touch the COX-1 enzyme, which creates the mucus lining of the stomach, so you
Okay.
don't have that side effect of ulcers and bleeding.
Okay, so we want to keep the COX. We want to keep all that
Keep the
in check.
COX-1.
All right.
COX-2 control the prostaglandin that controls inflammatory response of the body, but that's like that forest fire getting out of control where the inflammation is now, it's creating a problem, giving you arthritis pain. Inflammation protects, but inflammation out of control gives you pain. So, go to your Chinese herbal medicine store and ask for some Thunder God vine, and
Okay.
you're probably going to be able to inhibit the COX-2 enzymes as if you had it the same result from Vioxx without the side effects of death and destruction.
Well, they need to make sure that when they pick that up, that they get the advice of somebody that knows about that. Don't just go grab it and start taking it. Correct?
Oh, exactly, yeah. And, I mean, you should have a professional medical or alternative doctor or naturopath.
Advise you on when you start playing around with Chinese herbs.
Yeah. Or even a Chinese physician would
Okay.
be good for that one.
What about omega-3s, Richard?
Omega-3s, that one also, there's been a lot of studies as another method of COX-2 inhibition, and I think we have one more slide on that one.
We do. Omega-3 fatty acids, such as those found in fish oils, have been recommended for managing chronic inflammatory conditions, given their ability to alter prostaglandin production, there's that word again, and to yield measurable changes in certain disease parameters in rheumatoid arthritis patients.
Yeah, that's another alternative. I take that one, and I also take our own shark cartilage. I have bone on one knee, and as I'm getting older, occasionally I have a little ache and pain.
Shh, don't tell anybody. Don't tell anybody we're getting older.
Well, no, that since I
But
had
it's true,
my
I know.
25th birthday last year.
Oh, okay. Me too.
And, those are things, since we produce it ourselves and I'm not near a Chinese medicine doctor, I'm going to go for that. It's a lot easier, and I know it because I produced it, shark cartilage now for 13 years. And I use it a couple of capsules a day, and I go jogging every morning a couple of miles. And in the past, when I would stop taking it just because I'd be lazy, I can feel it in my knees after a
A little
couple days.
creaky, a little bit tighter.
Yeah, and if I take it, I have no pain, and that's a whole different area, the shark cartilage. But I was noticing, because we only started producing omega-3 fatty acids, the shark liver oil, about 4 years ago, that I could take a lot less shark cartilage and just take a couple of capsules of omega-3, but I didn't know the reason why was these doctors were finding that was stopping the prostaglandin production from the COX-2 enzymes,
Okay.
which was the inflammation response that my knee was getting from doing a lot of running.
So let me go ahead and make sure I understand this, okay? So the prostaglandin, so the COX-2 enzyme, is what we're trying to do, is we're trying to suppress that. Is that correct?
Suppress-
I feel like a
Yeah.
dummy a little bit
No,
about
no.
this, but it is complex, but it's simple too. So what's going on if somebody has inflammation of the joints, such as arthritis, that type of thing, it's become overactive, is that correct? Where it really shouldn't be in order to heal? Is that what's going on?
Yeah, well, the body is going to naturally, there's something wrong. In my case, it's bone on bone. The body knows this. So the first reaction is it's going to secrete this prostaglandin that was produced by the COX-2 enzymes.
Got it.
The prostaglandin is going to create swelling in that knee, which is going to give me more pain. But the body is really trying to do the right thing. It's going to swell the thing up in order to keep me from running on the thing. But it's really not doing any more damage because I don't, bone on bone, I don't have much cartilage in there. What's happened has happened. And as this Dr. Albani, and I've talked about this on a show a long time ago here, that what is happening is the body also has a second immune response to this problem, in that its cells in and around the joint are also secreting a substance that the body picks up as it thinks it's an E. coli infection, and it's sending these messengers to our T cells or white blood cells that, oh, we have an infection in and around the knee joint, and they all go over to that joint, these T cells, and attack the cells that are being secreted by the joint in response to the bone on bone and this inflammation, thinking that they're going to protect the body, in this case, from this unknown infection that really it doesn't have. And this is really our body's immune system becoming overactive, thinking that I got to protect it, I got to create inflammation, I've got to send the T cells down there, and it just further irritates the area in and around the joint and causes the joint to swell up. Whereas what the shark cartilage seems to be doing is interrupting that T cell response.
Okay.
And what the fish oil is doing is interrupting that prostaglandin inflammation response.
So they're doing two different things.
Exactly.
We actually have a viewer, since we're talking about inflammatory problems in supplements, we have a viewer that has a question for you. Let's take a look.
What can I take for back pain?
Oh, good question. Back pain.
Well, first response is, I used to throw my back out, and I weighed about 15 pounds more, and I wasn't running. But you got to get rid of the pain before you can do the exercise. And that viewer looked real quickly. It looked like he was a little bit overweight. And as we get older, and the muscles in our backs become less firm, and we'll throw that back out, which will cause the swelling, which causes the muscles in the back to react and start trying to protect the backbone from further pain.
One thing leads to another thing, leads to another thing, okay.
A whole series of things.
Right.
And having been there for 15 years ago, what I would first try to do is control the pain, because the pain isn't from necessarily that initial throwing of the joint, that usually it's the last vertebrae in the column that just moves a little bit, pinches the nerves, and then we got the muscles reacting, trying to prevent it, further damage, and we got the inflammation, is try to prevent further pain and inflammation. So I would first take, one of, the Thundervine or the Curry or the omega-3s, something that will stop the pain and the inflammation. And then part two is you got to look at, here in the health food industry, we're not just trying to treat the symptom, because he's looking at what's the symptom. The symptom is pain, but that's not really the problem. The problem is what caused the pain.
Right.
And looking at what the poor viewer the questioner was doing, he looked like he could probably lose 30 or 40 pounds, start eating right, doing more exercise, and maybe if you eliminate the condition that was causing that, we won't have him throwing his back out in the first place.
On that note, we'll be right back after this to finish up this wonderful subject about inflammation.
Remember when your skin had the soft texture and beautiful glow of youth? Seagate Smooth Skin is a therapeutic advance in skincare. Using all natural ingredients rich in antioxidants and omega-3 fatty acids, Smooth Skin moisturizes and rejuvenates your skin, protecting it from free radical damage, which can accelerate the signs of aging. Take care of your skin with Smooth Skin. Ask for Seagate products in your local health food store or call toll-free at 1-888-505-4283.
Welcome back to the Health and Wellness Marketplace with Richard Lentz of Seagate. Richard, we were talking about inflammation, arthritis, natural alternatives. What about grape skin?
Grape skin, one more alternative treatment. I think we've mentioned probably 6 of them. Resveratrol, phytochemical derived from grape skin, directly inhibits COX-2 activity and suppressed prostaglandin, again, production without affecting COX-1 protein expression. And this was from biochemical pharmacology. This is not health food advocates coming up with these inventions. But again, you can't patent grape skin extract. You can get it very easily in our grape seed extract, because we do a combination of grape seed and grape skin.
I love it, by the way. I just love taking that product. I mean, all these. I would go out and start eating curry and taking, and how do you say that, resveratrol?
Resveratrol.
Okay.
And basically what we're saying is, whether it's Seagate or it's an Indian curry or Chinese Thunder Guard, there's a lot of ways of dealing with pain, and also deal with pain through exercise and diet. And if we're eating the right foods and we're exercising, the chances are we're not going to have those conditions that are going to give us the inflammation in the first place. I would personally, I would run once my pain has gone away, and then I would take the supplements at the same time.
Right. Fix it first before it happens. Try to get stronger, and then fix it later on, too, if you can. Well, thank you so much, Richard. That's all we have time for today on the show. If you'd like to know more about Seagate and all the amazing products that they have to offer, you can call 888-505-GATE or 4283, or visit their website at SeagateProducts.com. Richard, again, thank you for stopping by the Health and Wellness Marketplace. It's always great to have you here. And to all of you at home, thank you for visiting the market as well. We're open again tomorrow at the same time, same place. So be sure to tune in, and don't forget to tell your friends about us. I'm Laura Lewis. See you next time on the Health and Wellness Marketplace. Have a great day.